Unit 8, Antimicrobial Agents. Microorganisms are present throughout the environment as well as the internal environment of the human body. When normal defense mechanisms are compromised or overpowered by virulent microorganisms, the human body is susceptible to infection. Antimicrobial agents used to treat infection along with applicable lab tests and patient education are discussed. Here are your objectives for this unit, and these are your reading assignments. Antimicrobial therapy. So these are things that we need to consider in selecting whether we should put somebody on antibiotics, and basically we need to look for evidence of infection. So on physical assessment, these are the signs and symptoms of infection. So usually there's changes in temperature. Usually there's an increase in temperature and increase in heart rate. In addition, there may be pain and tenderness in the area. So you may see some erythema, which is redness, pain, and swelling. Sometimes there's presence of body fluid, right? So there's discharges, and usually there's some color changes. Indications of infection, if usually the secretions are, let's say, clear and they start becoming yellow or green, that may be an indication of an infection going on. So influences. So there are different things that can influence that, including the host immune system or function. So our own immune system or human immune system or functioning. So definitely, sometimes if the immune system is still immature, such as infants, they may be at more risk for getting an infection. In addition, elderly are going to be at more risk for infection because over time, their immune system becomes less effective when it comes to fighting infections. At times, there are alteration in function. So our body's immune response sometimes is not the same. In the presence of chronic illness, drug side effects, examples of those. So when it comes to chronic illness, diabetes will put a patient at risk for getting an infection. Side effects will include the side effects of corticosteroids, right? Because it will increase the patient's susceptibility to getting an infection. Sometimes invasive procedures such as presence of IV or Foley catheter, as well as endotracheal tubes, tracheostomy, and surgery. So those are the things that can increase the risk for infection. Laboratory data. Leukocytosis. Leukocytosis is the increase in total number of white blood cells, basically when white blood cells or WBCs are above the normal range. Some causes of leukocytosis include infection in the bowels, inflammation such as rheumatoid arthritis, physiologic processes such as stress, exercise, sometimes allergic reactions. At times, you may hear the term left shift. Left shift is basically when there's more immature leukocytes, mainly neutrophils and bands, than the mature white blood cells. So there's a high number of young, immature white blood cells present, and usually the reason for that is infection, mainly bacterial infection, and occasionally inflammation. So the bone marrow is producing more white blood cells and they're releasing them into the blood before they're even fully mature. So that's what you call left shift. Gram stain, culture, and sensitivity testing. So when we talk about gram stain, this is a process wherein they try to apply color to the organism. So when the stain combines with the bacteria in a sample and the bacteria turns into either purple or pink. So if the bacteria stays purple, then they are considered gram positive. If the bacteria turns pink or red, they are called or considered gram negative. This is basically a test or a procedure to help identify the organism. In addition, the morphology is also considered. So they basically try to examine the cell shape of the organism. It can be either cocci, rod, or a spirilla or spirilla. Cocci or coccus is basically when the organism is spherical or round. Rod, on the other hand, it's basically shaped as a rod. And spirilla or spirilla is basically when the organism is shaped as a curve or spiral or twisted. Examples of gram-positive organisms. Gram-positive cocci includes Streptococcus and Staphylococcus. Gram-positive rods include Clostridium, and gram-negative cocci is Neisseria. Gram-negative rods include Pseudomonas, Escherichia, and Klebsiella. So gram-positive organisms are considered to have thick cell wall. On the other hand, gram-negative are considered to have more complex cell wall and more difficult to penetrate. So this is something to consider when it comes to treating these infections. Culture. So this is basically the step when the microbes are classified and identified. Sometimes they can identify the microorganism as a bacteria, fungus, virus, or mycobacterium. Bacteria, Staphylococcus, Streptococcus. Fungus include Aspergillus, Candida and coccidiosis virus include the influenza virus, hepatitis, human immunodeficiency virus, and rubella. And Mycobacterium includes Mycobacterium tuberculosis, which is the causative organism for TB or tuberculosis. Next would be your sensitivity. So sensitivity is basically identifying the antimicrobial agent which is active against microbe. So it identifies which antibiotics are gonna work or not gonna work for a certain organism or infection. Antibiotic therapy can be either prophylactic, empiric, or direct. So when we say prophylactic, it's basically preventative. So antibiotics are taken before an anticipated exposure to an infectious organism in an effort to prevent the development of an infection. So instances when prophylactic antibiotic is administered is prior to a surgical procedure. Now, empiric, on the other hand, is basically the administration of antibiotics based on the practitioner's judgment of pathogens most likely to be causing an apparent infection. The provider presumes that there's a certain common organism that's causing that infection, so therefore it's treated according to that assumption in order to avoid treatment delay before the culture information has been obtained. This is done while waiting for culture and sensitivity results. Now, direct or definitive therapy is basically the administration of antibiotic based on known results of a culture and sensitivity testing. Basically, we've already identified the pathogen causing the infection. So we know what microorganism is causing the infection and we're treating it based on that knowledge. Things to consider. Allergy. It is very important to assess for allergy, especially when it comes to penicillin and cephalosporin. Sometimes the presence of cephalosporin allergy is an indicative of high likelihood of allergy to penicillins and vice versa. Now, organ functions, especially when it comes to your kidney and liver, it is very important to assess and evaluate the kidney function, your liver function, because certain antibiotics will actually worsen kidney function and liver function. So we have to be very careful before administering those medications, and at the same time we need to evaluate after administering those medications, especially if those laboratory tests are available to us. Next thing to consider is the concurrent use of antimicrobial agents. Concurrent use of antimicrobial agents, it is very important to consider which antibiotics the patient is on, because there are instances of incompatibility in case you have to administer simultaneously, and there are instances of interactions. At the same time, administering certain drugs at the same time can cause increase in toxicity. Colonization. So colonization basically pertains to your normal flora. This is establishment and growth of microorganisms on the skin, open wounds, or mucous membranes without causing an infection. So it doesn't always mean that there's an infection when there's presence of microorganisms. Sometimes it's just really the presence of normal flora or normal organisms in that area. Superinfection, on the other hand, it can occur when antibiotics reduce or completely eliminate the normal bacterial flora. So the normal flora consists of certain bacteria and fungus that are needed to maintain normal function of various organs. So when killed by antibiotics, other bacteria or fungus are permitted to take over and cause an infection. An example of this is the development of vaginal yeast infection when normal vaginal bacteria flora is reduced by antibiotic therapy. So yeast growth is no longer kept in balance. Now, secondary infection, this is a type of superinfection. So this closely follows initial infection and comes from an external source, so as opposed to the normal flora. So an example of this would be a viral respiratory infection, and then after that, a patient will develop a secondary bacterial infection, an ear infection after suffering from the flu. So this is often due to the weakening of a patient's immune system function by the initial viral infection. Patient education. So it is very important to educate our patient when it comes to the appropriateness of use of antimicrobial agents. A very specific thing is sometimes when family members or patients would request for antibiotics when they actually have a cold, right? It's caused by a viral infection. So we need to educate them that antibiotics are used for bacterial infection. Guidelines for how to take the drug. So it is very important to instruct them how are they taking this medication, how often, when, right? Do they take it with food, without food, and all that. And also, we need to make sure that we need to educate them when it comes to the course of treatment. How long is it going to take? Is it 5 days, 7 days, 2 weeks, right? That's very important for them to know. And also potential side effects and drug interactions. Antimicrobial classification. So these are some broad terms that you may hear, and some of them are used interchangeably. Antibiotics, antimicrobial, and antibacterial are terms used interchangeably and basically refers to agents that either kill microorganisms or stop their growth. Now, antifungal, on the other hand, are basically agents that treat or prevent fungal infections. Mechanism of action of antimicrobials depend on the drug. So these are the most common mechanism of actions of antimicrobials or antibiotics. 1. They interfere with DNA and RNA replication. So this is very important in cell biology, especially in storing and reading genetic information. Next, they act on cell membrane, so increases the cell permeability, therefore causing the leakage. 3. Disrupting metabolic reaction in the cell. 4. Affect bacterial RNA or DNA. And then 5. Block the enzyme activity. So pharmacological classifications, they use chemical structure for antimicrobials like aminoglycosides, fluoroquinolones, macrolides, cephalosporins, and so on.